Hi, everybody. Ann Louise Gittleman here for the First Lady of Nutrition podcast. And today on the First Lady of Nutrition podcast, we have the First Lady of Nutritional Medicine, who is none other than Hyla, MD, who is not only a physician, but she's a well-known, well-beloved, and extremely respected psychiatrist. She currently helps individuals withdraw from psychiatric medications and is now an expert on the use of targeted nutritional supplements, including CBD, hemp oil extract. And her topic today, with which she is most impassioned, is CBD and the brain. So good day, Hyla, MD.
Hey, great to be talking to you, Ann Louise.
So Hyla, you have been in the business of health for many decades, and you are now very impassioned about the use of CBD. Tell me why.
Well, it's an interesting thing because we're hearing so much about it and people are wondering, hey, is it hype? It can't be doing all the things that people say it can do. But I'll give you a little history about with CBD. I had a friend who wrote a book on CBD and sent it to me. And I said, oh, it's just an excuse for people to get high. That was my response. I can't believe it. But that was about 4 years ago. And because I don't have, I'm not against medical marijuana. It's just not my area. And I've also seen a lot of problems that people have had with weed. So it wasn't my favorite. So that's where I put CBD and just kind of left it there. And then it gradually began to creep into my awareness. And finally, after reading some of the research and then beginning very slowly to try it on patients, I said, whoa, this is a really excellent product. And it's scientifically sound. It works through something called the endocannabinoid system. So we can explain why it works the way it does. And it ends up doing so many things, like in my field of psychiatry, which is having to do with anxiety, sleep, post-traumatic stress disorder, OCD, social anxiety, traumatic brain injury, on and on. So it has really far-reaching effects, and it's quite safe.
So how does this differ for those of us that are uninitiated? What is the difference between the CBD oil and marijuana? I know there's a THC psychoactive component that's missing in CBD oil. Is that the only difference?
That's pretty much the difference. Well, let me explain. They both come from the cannabis plant. And one branch of the cannabis plant is hemp. And hemp has been, because you can breed things however you breed them, things become hybrid and they're bred for more or less THC. So what happened was the two fractions, let's say. The hemp plant was grown out of cannabis to be long and stocky and tough to make fiber, paper, cloth, and so much was used for these things before we began cutting down trees for them. So, now we're cutting down trees for paper. But in those days, we used hemp, and it was good. It's a renewable resource. And so that's the hemp plant, and it doesn't contain much THC. It does contain a small amount, and in fact, to be officially accepted as hemp and not marijuana, it has to have less than 0.3% THC in it, tetrahydrocannabinol, which is the part that makes you get high. Then on the other hand, you have marijuana or weed or pot, whatever you call it, depending on your generation. And it contains these days a tremendously high amount of THC because it's bred to be recreational and to get people high. And that's where actually a lot of people get into trouble. And what's interesting is that the CBD can rescue them from the hyper reaction that they get from THC. That doesn't happen to everyone, but because it's so strong, it's happening in a lot of people. So it's really good to be able to bring them down with CBD rather than a drug.
So what does CBD contain that makes it so special? You talked about the the particular system of, I guess it's kind of like happy molecules, that type of a thing, but are there specific nutrients, essential fatty acids, vitamins, minerals, or whatever that the CBD contains that makes it so efficacious?
Well, what it is the hemp plant, the hemp extract, which it's better called, it's better, more accurately referred to as hemp oil extract, because it contains CBD and some other cannabinoids, or CBN, CBG, and each of these other cannabinoids has its own action. Like CBN is really good for sleep, others are very good for pain, and the terpenes, we know from herbal medicine how important the terpenes are. They give the plants their specific smell. Like lemon has a certain smell from its terpenes, or lavender has that very distinct smell from its terpenes, and the same for THC. I mean, you're not going to mistake that skunky smell, and that's from terpenes. So when we talk about when we talk about CBD, we're really referring to the whole hemp extract. There is CBD isolate, where they take it completely away from the terpenes and the other cannabinoids, but then you don't have the full spectrum. It's the same thing with herbs. With herbs, we'll have a marker substance, like with St. John's wort, it's hypericin, but you're not going to give someone just straight hypericin. You're going to give them the whole plant, because there's a synergy among all the components. So by the same token, when you give somebody hemp oil extract, you're giving them the combination, which gives what's called the entourage effect, or the synergistic effect of the different cannabinoids, the terpenes. There are also some essential fatty acids, vitamins, and minerals in it, because this is nature, and nature has a lot of different components, and they're beneficial. So that's why CBD whole plant is the way to go, the whole extract.
Do you think people are in need of this particular product now more than ever, because there's an uptick in anxiety, trauma, post-traumatic stress, or a greater awareness? What have you seen in your own practice over the years?
I've seen, like right now, people are very stressed, very anxious.
And we're in the midst of the pandemic, everyone, just so that you get a sense of this.
Yeah. And it's really challenging. What the endocannabinoid system does, now the CBD interacts with something called the endocannabinoid system, which I'll explain in a minute. So by interacting with the endocannabinoid system, it is encouraging the actions of the endocannabinoid system, and those are to help us be protected, help us to rest, help us to reduce stress, and help us to sleep and feel calm, which is kind of a prescription for the moment.
To say the least.
So that's actually what it does. And we actually make our own endocannabinoids. So I'm talking first of all about the phytocannabinoids, PHYTO, each plant-based, the phytocannabinoids, which are CBD, THC, which we're not going to really be talking about, and all those other cannabinoids. But those are made from in the plant. So in our bodies, we make our own endocannabinoids, which means internal, self-made. And the endocannabinoid system is what, as I said, is to rest, help us to rest and protect and to de-stress. So when we don't have enough of our own endocannabinoids, one of them being anandamide, if we don't have enough of those, we're going to feel depressed, anxious, be prone to PTSD, be prone to OCD, a number of different things, different conditions. When we can bring up our endocannabinoid system, and we can do that with CBD, a lot of these issues resolve themselves. So you don't have to have, psychoanalysis on the couch, although that's many years ago, talk therapy. Not that psychotherapy isn't a good thing, and I think some of the energy psychologies are particularly good. They're quick and they get to the point. things like EMDR, EFT, and so on. But it short circuits a lot of the negativity by giving you more endocannabinoids. It raises your endocannabinoids so that you're more able to deal with stress, anxiety, more able to go into a more restful phase, into a more what's called the parasympathetic phase, as opposed to the fight or flight or sympathetic phase.
So would you say, and you have been using minerals, and you certainly wrote a book about St. John's wort, which was a huge bestseller, and you've written several other very best-selling books. Would you say that the CBD oil is at the vanguard of a revolution of different types of treatment now for mental health?
I think so. And I think because it's being so widely accepted for so many other things, like pain, PMS, menopausal issues, and because it's so popular, it's actually showing people that they don't have to rely on psychiatric medications for relief. Now, I'm not saying, hey, get off your medications, just throw them away. That's a whole other topic. And I talk a lot about how to very gradually come off medications if that's indicated. And CBD actually helps a lot in coming off it. And by the way, when I say CBD, I'm really referring to the whole hemp extract. So it's just kind of a short form. I'm not talking about isolated CBD.
So is there a difference today, other than the fact that we're in the midst of this very frightening, very stressful pandemic? Have you seen over the years that people have become more anxious, have become more depressed, have become more irritable, lack of sleep? Has it been a slow decline, would you say,
Yes.
in terms of, I mean, I've seen it in my own nutritional practice. I just need confirmation from you as a psychiatrist.
Yeah, well, we have a lot more going on. We have, for example, more cell phones, more Wi-Fi. Really big, you know that.
A topic that you and I share a mutual interest in, yes, indeed.
So that is particularly troubling right now. I mean, I'm very concerned, and our children are being exposed, and that raises an anxiety level, and people have no idea that that's what's causing their anxiety. I've had people who it turned out, were right across from a tower, or a cell tower was facing their bedroom, and they were being bombarded. So it's a very difficult situation. So that's one of them. The food that people are eating is less and less nourishing. Not your audience or my audience particularly, but the majority are eating the standard American diet, which is horrifying. And that causes anxiety because we don't then have, when we eat those foods, we don't have the right vitamins, minerals, amino acids, blood sugar balance to keep our mood going in a very smooth, nice way. Just blood sugar issues, people being addicted to sugar, and the increase in sugar now with the pandemic. People are just scarfing up carbohydrates, simple carbs and sugar, pastries, you name it, all the comfort foods. So that's also scary, and it's scary for our children.
So you at one time had a very active, very robust nutritional practice, and I know that you're slowly getting out of that. Do you currently consult with individuals?
I do, because a lot of people don't know where to turn. They know that they're having what could be labeled psychiatric issues or mental health issues like anxiety, depression, OCD, whatever. And the conventional medical world doesn't really have much to offer except medication, which is not the solution. So what I will do is have a consultation and point them in the right direction, what supplements to take, what further work they need to do, make a specific referral to somebody if that's indicated. So by doing that, I have a lot of leverage. So I may not be seeing everybody from start to finish, but very often I can get a lot of leverage just by telling them a few things that they may not have known.
And then, so Dr. Cass, how can people get in touch with you if any of our listening audience wants to avail of your services? Is there an email address you can offer?
Yes. You go to my website, cassmd.com, and there's a place where you can just enter a query. You put in your email and you can get hold of me.
So would you say then that in terms of CBD oil, are you using this exclusively now in your consultations, or are you using this in conjunction with any other key vitamins and minerals? And if so, which would they be?
Oh, I'm so glad you asked. Ha!
Good question.
Because I don't believe that there's going to be one single thing that's going to do it. We still need the raw materials, for example, to make the neurotransmitters. So we need to make serotonin, we need to make dopamine, we need to make GABA. That's a big one. You know, it's the calming neurotransmitter. So, of course, I'm also recommending the healthy diet, sufficient protein. You want to keep your blood sugar balanced, and a host of amino acids, the precursors or the raw materials that make your neurotransmitters. Then the CBD, this is where CBD is really wonderful, because it's like a balancer or a conductor, an orchestra conductor. So we have all these neurotransmitters, and they have to know, you know, do we need more GABA right now? Do we need more dopamine right now? That's where CBD comes in. It's like the conductor, which modulates which ones are being in use when. And it helps you to calm down at night, get active in the morning. And it's really quite elegant the way it works as a system. So it's my go-to. Pretty much everyone I see ends up using CBD. It's great for helping people get off of medication, which is one of the things I do. And I even, after looking around at the different products, I actually ended up doing one of my own and flavored it so that it wouldn't be so, so kind of grassy tasting like a lot of it is. And I wanted to know what the ingredients were, and that it was non-GMO and so on. So that's what I actually recommend to my patients and readers.
And how do people get in touch with that product, a hold of it?
It's on my website, cassmd.com, the same place you go to email me. But if you do cassmd.com/hemp oil, HEMPOIL, hemp oil, one word, you'll get right to it. But you can also navigate to it through.
So people don't need a prescription for this?
Good question. People have asked me, they don't need a prescription and they don't need to go to a dispensary. Now for medical marijuana, which by the way certainly has its place, for medical marijuana you need to go to a dispensary. In some states you need a prescription, in other states you can just go and get it recreationally. On the other hand, CBD you can get over the counter. They have it, you know, I see it at gas stations. Of course, I don't think I'd recommend buying it at a gas station. You just don't know what's in it. You don't know where it was grown. You don't know what the additives are. So you need to know your source.
So you can take CBD oil by the spoonful, in pills, in potions, in lotions. Is it just as effective topically for pain relief?
It's different. When people have, for example, muscle pain, I say do both. Put it directly on it as a salve and take it internally, because it's going to decrease inflammation throughout your body. Because wherever you're feeling it, there's also going to be inflammation elsewhere. So it's really, and the way to dose it is really pretty individual. I'd say for people to start with the lowest dose bottle, a 500 milligram bottle, and then gradually start off with say a half a dropper, and then if you don't notice an effect, take a whole dropper about a half hour later, and you just keep titrating up over the next couple of hours till you get a dose that is hitting your target symptom. I had an anxious young man in my office some time ago, and he was not happy to be there. His mother had brought him there. He's 20 years old, and you know how kids are. He didn't want to be there, and I said, would you be willing to take some supplements? No, they don't work. Okay, I said. And in fact, he'd had supplements in the past and they had worked. I said, would you be willing to try some CBD? Have you ever had any? Okay, very reluctantly. So I dropped, dropper full under his tongue. And then I was talking to his mom. And about 5 minutes later, I turned back to him and I said, so how you feeling? And he said, he kind of looked surprised. I said, oh, wow, I'm feeling really better. This is the calmest I felt in I don't know how long.
And what was that, 5 seconds later?
It was 5 minutes later.
Oh my gosh.
And I was impressed. And he had been highly anxious. What was going on is he was smoking too much weed. And rather than it's calming him, it was actually agitating him. At the same time, he was in a way addicted to it. So he couldn't stop, but he was anxious. And by taking the CBD, he got to feel calm. And by taking it, and we got his dose adjusted, he was able to stop using pot because he didn't need it.
That would be my hope, that you can get all these people off of pot, which in my experience has been a gateway drug to something more deleterious, and then just balance them out with the CBD. This would be my hope. Do you see that happening, that CBD oil will take over the globe at some point? I mean, it's just it's exploding. It's all over the place.
Well, that's very interesting. What I'm seeing is people who had been promoting, for example, education in the use of marijuana or cannabis, are now giving courses in the use of CBD, and they've kind of not quite abandoned, but they've really minimized the other, because you really get more bang for your buck from CBD. You don't get the munchies. You don't get high, so you can keep your brain on during the day and function properly with CBD. And it has so many side benefits. Never mind side effects that you get from drugs, but side benefits that it sells itself. And I love it because it's natural, because it works with our endocannabinoid system, which is so important that we didn't even know about it, till about 10 years ago. And it's something that we've actually needed. We stopped ingesting hemp a long time ago. If you remember, it was banned.
Yes.
And we used to actually get a certain level of hemp. We couldn't even eat hemp seeds. Now, of course, hemp seeds are available. CBD is available. And that's very hopeful about being able to restore our individual endocannabinoid systems.
Well, something very interesting, which I think you'll find fascinating. I have read that hemp seed oil in and of itself has an anti-radiation benefit. In other words, you don't absorb as much radioactive particles with the hemp seed oil. So in a way, it is really the oil for this day and time, because of the deluge of EMFs that we're all exposed to, among other toxins and so forth. And it's also a high source of omega-6, which is so important for the structure of the cell membrane. So I think it's a very important, how shall we say, new product that's on the market. Do you see any downsides of the CBD oil?
I don't. What I do say is that if you're on a medication, you need to check with, and I have this on my website, you need to check to see if that drug is metabolized by the same, what is called P450 enzyme system in the liver, because that could, theoretically, it could interfere with the medication, if you take CBD with the medication. But the truth is, if you're taking under 100 milligrams, and most people are taking around 25, at the most 50 milligrams, it's really not an issue. And you take it several hours apart from the medication. But I do have that warning.
Well, that's absolutely good to know. Is this good for everybody of every age and stage of life? Infants, children, toddlers, teens, adults, the elderly?
It's been great for the elderly, by the way, because they have so often been given potent medications that elderly people should not be given, that we're just, knocking them out. Is dangerous because it makes them fall, and also their metabolism isn't as good as it was, and they're not metabolizing the drug, so they have a lot of side effects and liver effects. So substituting CBD for the elderly has been amazing. So in those, for example, nursing homes and other facilities where the elderly live, it's been a real boon. There aren't enough of them doing it, unfortunately. And then with children, there's actually a drug called Epidiolex, which is CBD isolate, very expensive, used for children with intractable seizures called Dravet syndrome. Now, you can actually use CBD for it because you can use full spectrum CBD and actually use a lot less of it because it's not an isolate. But that's that's a bit of a digression here because we're not dealing with the drug world, and I'm actually not treating seizures in kids, but you were asking about kids. It's been really miraculous for those families.
So would you also suggest that this should be part of everybody's basic preventative routine, just the way we should be taking a daily multiple for dietary insurance and so forth? Would you suggest something like a tablespoon of CBD oil in your smoothie, for example?
No, because it's measured much more discreetly. Because, and in fact, I'm glad you mentioned that because you were talking about the advantages of hemp oil and it's how it helps against radiation and other things. That's hemp oil. This is hemp oil extract, much more refined.
And much more potent, I would imagine.
And much more potent.
Right.
So it's really a different animal. I'd say take hemp seed oil anyway, and put that in your
In
smoothie.
addition to, I see.
Yeah.
I see, very good.
That. But to the concentrated cannabinoids, terpenes, and the whole entourage effect, you'd want to take that if you need it. People who have symptoms of, say, anxiety, depression, difficulty sleeping, waking up at night, migraines, pain, traumatic brain injury, all of these things, these are serious issues, and they are a reflection of a low endocannabinoid system. So you need it. But if you don't have any of these, there's no reason to take it, or you can try it and say, wow, I didn't even think I needed it, but I just realized that I had this shoulder pain that I wasn't really paying attention to, or someone takes it for neck pain and it ends up treating their PMS. So, it goes both ways. You can try it out, but I'm not saying everybody should take it every day. You take it when you need it. And some people have a genetically low endocannabinoid system, or they're under undue stress. And so in a way, it kind of burns up. So you need to replenish it, and it needs all the help it can get. So it's something you can pretty much titrate. You can figure it out yourself. And when you're taking it, you start off low and slow. You start off with the lowest dose. You take a half a dropper full, then you take a dropper full, and then maybe 1.5 droppers, 2 droppers, until you get, over the course of a few hours, till you get to your sweet spot. And sometimes you get there right away, like that kid I was telling you about, he got there right away, or a friend of mine who had sciatica, and we were walking a trade show together. So I suggested he try it. He'd never tried it before. And within a few minutes, he established how much he needed. I gave him the bottle, and he walked the trade perfectly for the next few days. And that was that. He has continued to take it. As long as he has sciatica, he's taking that. He has some lower back issues, which cause that.
So do you have any really dramatic case histories that you might be able to share with our podcast audience before we leave you? I know you've got a very busy schedule, and I'm so grateful for the time that you're spending, Dr. Hyla Cass. But anything really dramatic that'll make people's jaws drop?
Well, I don't know if this is jaw-dropping. One of my cases was a woman who was an elderly woman in her mid-80s. Her family brought her to me because they were about to put her in a home. And she was really kind of out of it. She was sitting there, sitting opposite me, kind of falling asleep. So what I did, and she was on a number of medications. So what I did was I gave them a schedule for removing the meds from her and putting her on CBD. And they misread my directions. So instead of taking, say, 6 weeks to get off the medications, they did it in 2 weeks.
Wow.
But she was also taking the CBD. She was taking it separately, so it was safe. And by the end of 2 weeks, she was off the meds and actually able to converse, make eye contact, remember where she was, talk about what restaurant she wanted to go to, and she was back in the game.
Mm.
And I followed her for another few years, and she kept it up.
Wow.
So that, that's important, because we do know there is research that it does help with dementia. We also know that it helps with traumatic brain injury, which has been really difficult to treat. So with traumatic brain injury, we use high dose essential fatty acids as well as high dose CBD, and again, get really good results.
So you wrote a little ebook, if I'm not mistaken. We spoke a little bit before the taped interview. Do you think you'll be able to make that available to my listening audience at some point?
Sure, yeah. It's called The Miracle of CBD. It's not available in general online. It's something that I did for my own readers. So they can get it through you. I'll give you a link.
Very good. Any other parting words before we say goodbye?
Oh, wow, that went fast.
It was fascinating. Yes, we've been speaking quite a while. I mean, this just really flew by. This has been so interesting, and it's an area that I have been interested in but know very little about, because back in the 60s and 70s I never inhaled, nor did I even smoke anything of the cannabis family, quite frankly. So I've stayed away from it. So this is opening my eyes and my ears up to new possibilities of health and healing.
Well, that would be my conclusion. It's like we have a whole new tool in our toolbox for health and healing and calming us down and allowing us to focus and do what we want to do, live the life we want to live, instead of being drowned by anxiety and stress. And this is something people can do themselves. So they don't need to go to a doctor, get a prescription. It's very safe, very effective. And I have a number of blogs on my website about it, and a lot of information in the link that I already told you about, which was cassmd.com/hempoil. So there's quite a lot of information. It needs to be rewritten and made to look a little prettier, but it's all there.
So I want to thank you so much for being on the cutting edge, as always, with health and healing. And I think, coming from somebody with your very prestigious background, learning about all the alternatives to anxiety, to irritability, to lack of sleep, it's very promising. And so for those of you that want more information, cassmd.com/hempoil, and we're going to get a little ebook, The Miracle of Hemp Oil. We're going to get a link for you on the comments here. So I want to thank you once again, Dr. Hyla Cass, for being my guest, and tell everybody to stay tuned for the next episode of the First Lady of Nutrition podcast. Goodbye and much love.